have two fantastic presentations, and since we are starting a little late, I just want to jump right in. Our first presentation is going to be from Access Health Connecticut. So I would love to turn it over. Two fantastic presentations, and since we are starting, sorry about that. If you could introduce the team that's here, that'd be fantastic.
Sure, and thank you, Representative Gilchrist. My name is Susan Richby, and I'm the Director of Legal and Governmental Affairs at Access Health Connecticut. And joining me today are Kelly Cody and Katie Hearn, who will be presenting some really important information to you. And I just wanted to share that James Michelle, our CEO, and Kathy Tallerita, our Manager of Governmental Affairs, are actually in a meeting with the governor right now, but they will join us if time permits. So I will turn it over to Katie Hearn, who is our Training and QA Manager. And then after that, Kelly Cody will give you more information.
Great, thank you, Susan. Thank you, Representative Gilchrist. Thanks for the opportunity to speak with you all today. I'm not sure I'm seeing the slide here, so do we have?
Can you all, Kathy had sent you the slide deck?
Kate, are you able to do that?
I should be able to grab the presentation, yes.
Sorry, I meant Kate Hamilton. There's multiple Kates, but
yes, I can.
Okay, great.
So this one is, I'm sorry, can you tell me again whose slides I need to put up first? I have a couple of them and I was on YouTube fixing things there.
Access Health Connecticut.
Okay, I'll be right there.
Welcome to those who just joined us. We're just putting up the PowerPoint and going to have a presentation from Access Health Connecticut.
Good afternoon. Thank you, Representative. Hello.
Hello.
Susan, it might be faster. I made you a co-host, so it might be faster. If you want to share them, you're able to now. If not, I can pull them up. I might have them pulled up. It's just whatever.
Yep. Sorry, I'm going to. Okay, are we good?
Yes.
Yes.
Thank you. Okay, for my portion of this presentation, I'd just like to give you a brief overview of what Access Health Connecticut does. Is my audio okay?
Yes.
Okay, great. Okay, next slide, please.
That's me.
Next slide, too. Okay. So as you are likely aware, Access Health Connecticut's mission is to increase the number of insured residents in the state of Connecticut to improve healthcare quality, lower costs, and reduce healthcare disparities. We have plans and coverage available to individuals, families, and small businesses. And the Access Health CT website and Access Health CT call center and partners are there to help people shop, compare plans, and enroll in quality healthcare plans from, brand name insurance companies that many of us are familiar with. And we also provide access to many of the Husky Health programs in the state of Connecticut. Access Health CT is the only marketplace in Connecticut where you can qualify for financial help with medical coverage. As I mentioned, we serve individuals, families, and small businesses. So here I wanted to focus on individuals, Connecticut residents who apply through Access Health Connecticut may be eligible for Husky A, Husky D, or the Children's Health Insurance Program, also known as CHIP, or also known as Husky B. And those programs are available at no or at a low cost. Husky B Band 2 has a premium, but for the most part, those programs are no cost. We also have qualified health plans available at full cost or at a subsidized rate where premiums are subsidized by advanced premium tax credits. Advanced premium tax credits are applied to monthly premiums for those who qualify, thereby reducing their monthly bills. And many Connecticut residents may also qualify for cost sharing reductions. And cost sharing reductions reduce out-of-pocket costs for health insurance. More recently, we now also offer the Covered Connecticut program. The state legislature implemented legislation in just this year that allows for certain annual income ranges, that allows individuals in a certain income range to receive coverage at no cost. The Covered Connecticut program has a $0 premium and has $0 out-of-pocket costs for those who qualify. As I mentioned, Access Health Connecticut serves residents of Connecticut. Connecticut residents currently have to be lawfully present. They can be US citizens by birth or naturalization, or they can have a valid current US immigration status. Please note that people eligible for Medicare generally cannot purchase a plan through Access Health CT. There are Medicare supplement plans available for them, but Access Health Connecticut is not the place to look for a Medicare supplement. There are specific plans for that. Also, if you have some other form of public minimum essential coverage like VA benefits, TRICARE, or Peace Corps benefits, you would not be eligible for subsidies through Access Health CT. You would not be able to receive tax credits, although you could purchase a qualified health plan through Access Health Connecticut. So the carriers that we mentioned earlier are well known. Connecticut actually is a carrier that has sort of two entities now. One is Connecticut Benefits, Inc., and the other is the Connecticut Insurance Company, Inc. They are separate entities. Both offer plans through Access Health Connecticut. Anthem Blue Cross Blue Shield also offers plans through Access Health Connecticut. And of course, many of the Husky Health programs are available through Access Health Connecticut. Husky Health programs that are also known as MAGI or Modified Adjusted Gross Income programs specifically are available through Access Health Connecticut. If a household or an individual qualifies for a Husky Health program offered through the exchange, they can apply at any time during the year. If an individual or household is looking to purchase a qualified health plan, There are qualifying life events outside of the open enrollment period that may allow them to purchase a plan. There are specific qualifying life events, and we do have information about those on our website. And of course, currently we are in our annual open enrollment period, which runs from November 1st through January 15th. We offer small business coverage. This also is rolling. Any small business can apply at any time during the year. There is no specific open enrollment period for our small business coverage. And small business tax credits may apply. And our plans are offered to businesses who have between 1 and 50 employees. I wanted to go through just some of the basic terms. Advanced premium tax credits, as I mentioned, reduce monthly premium bills. So an advanced premium tax credit lowers your monthly premium bill. Cost sharing reduction lowers out-of-pocket expenses, such as coinsurance and deductibles. The Covered Connecticut program is a zero-cost program for those who qualify. There are specific criteria to qualify for the Covered Connecticut program. We have information about that listed in the appendix of this presentation. And if for those who qualify, they must be enrolled in a silver level plan. And Husky Health programs and CHIP are also offered at low or no cost.
Oh, sorry. Hold on a sec, sorry about that.
Sorry, just one moment.
Sorry about that. We just wanted to point out also that there are outreach opportunities available through our outreach efforts that we do throughout the year. There are enrollment fairs and in-person enrollment locations that we offer. We also have healthy chat presentations that we do throughout the year. We do an outreach tour. There are several events on that. And then we have 2 navigator organizations that we partner with, Project Access and Community Renewal Team. So in the future, if there is something that the committee, members were interested in messaging on breast cancer prevention or treatment, those are some opportunities that might be available that we could, provide you with.
Additional resources are listed here.
You're muted.
I'm sorry, thank you. Here are some additional resources. Our main website is accesshealthct.com. We have a Get Help section of that website, and there you will find access to live chat through our call center. You can find a certified broker to assist with qualified health plan selection. There's no cost for using a broker. And our call center hours of operations are also listed on the Get Help page. And as Susan mentioned, we currently have enrollment fairs going on. They're often scheduled on Saturdays. We have a few regular enrollment locations. We have one in East Hartford, one in Stamford. And we have 2 organizations that are navigator organizations who help assist with enrollments as well. And that number listed at the bottom is our call center number. Anyone who calls that number can receive assistance with an enrollment application.
Thank you, Katie. I'm Kelly Cody, and I'm going to present to you the plan options that are offered through Access Health. So the first slide here is talking about what kind of coverage we include. So there are 10 categories of services that are covered by our health insurance plans under the ACA rules, and those are considered essential health benefits, or EHBs. And in those categories, preventive health services is embedded. In addition to that, any state of Connecticut mandated benefits are included in our plans, and that also the state of Connecticut actually has several mandates that does support women's health. All of our plans offered through Access Health must follow the Connecticut benchmark plan, which includes what I just mentioned, the ACA, and all the Connecticut state mandated benefits for fully insured plans. And one of the most important pieces of information on this slide is, regardless of metal level or plan design, every one of our plans that we offer includes the preventive and wellness services relating to breast cancer. So we'll get a little bit more into that in the next couple of slides. So go ahead, you could go ahead. For the preventive care benefits, the most important part is everything that's on this screen is without co-payment or co-insurance, regardless if the consumer or family, if it's a family, has met deductibles, plan deductibles. So mammography screenings, it's outlined here what the age brackets are. We follow the state of Connecticut mandate. In addition to mammography screenings, there's also counseling for women that are at high risk for genetic testing and chemo prevention, which are two important pieces of the puzzle. Next slide, please. So moving on to the wellness side of the house, this is for treatment and follow-up care. While these services are embedded in all of our plans and could be an ACA requirement or a state mandate, these benefits or services may have a co-payment or co-insurance, or a deductible could apply. And that really is based on which plan selection a consumer may make. So reconstructive surgery, chemotherapy and radiation, mastectomy, removal of breast implants, which I believe that one is actually a Connecticut state mandate, and anti-cancer medications are all embedded in every one of the plans that we offer. Next slide, please. So this screen, as Katie broke out in between individual and small group or small business, I'm going to show you the differences of plans that we offer. For 2022, we have 27 different plans to choose from, and there are a variety of plans that we do offer. So the grid here is breaking down by medical product, HMO, POS, EPO, and PPO. It further breaks down by the metal levels. And we do offer a catastrophic plan. There are some limitations to that. So I won't have too much of a focus on that, but we do offer a bronze, silver, and gold plan. And what that really means is it's identifying a different actuarial value, which is the guidance from the ACA requirements. So those plans are dictating the cost of claims from a carrier standpoint versus a member's standpoint. So with a bronze plan, the premiums might be a little bit cheaper, but there's going to be a little bit more out-of-pocket cost for a member versus if they were in a platinum plan where you would expect to pay a little bit more for monthly premiums, but your claim costs might be less because the carrier is going to take on a bigger piece of that puzzle. So in offering the plans, this also meets our goal of giving the consumers of Connecticut options to choose the right plan for either themselves or for their families. The different products, while there's a variety of different copay, coinsurance, and deductible amounts, they also have different types of networks that may be better for a family versus an individual, or maybe an individual who has specific needs. If you could go to the next slide. For small business, for the year 2022, we will have 11 plans this year. And again, this screen is just breaking down for you the amount of plans by product and by metal level. Again, establishing that we do provide many or multiple options for our consumers from a small business standpoint. One thing I do want to mention is that all of these plans, again, I talked a little bit about the ACA and the actuarial values. They all follow the mental health parities. And again, they all still include any state or ACA mandates. Next slide. Oh, we're up to questions.
Wonderful. Thank you so much. This has been really incredibly helpful information. I have a question, then I'll open it up to folks. Back to the navigator organizations, would you be able to talk more about that and what the two, I think it said Project Access and I couldn't take down the other one. What do they do? Part of our charge is outreach, so it would just be helpful to know what you all are doing.
Sure, this is Susan Richby. We are required under the ACA to have navigator organizations to make grants to them. So we have a competitive process, and we invite organizations to apply, and organizations that can meet our specific needs, geographically in the state. Also, it might be, ethnic and racial diversity, income, age, a variety of different criteria that we set up so that we're really, meeting the needs of the community and people in the state. So these organizations, as Katie mentioned, they work for us year round. They assist during open enrollment, and they also provide outreach throughout the year. And some of that may be, health insurance literacy, understanding your plan and the benefits and how it works, understanding enrollment. There are other things, the financial assistance Katie mentioned. It is an application process, and people may have to submit documents to verify the income that they attest to in their application, or some of the other information in their application. So navigators are there to help them navigate their way through the process so that they, can obtain health insurance coverage, keep it throughout the year, and use it and really maximize it to support their health. So that might be an opportunity, as we touched on with outreach opportunities, tied to what this group is looking at, to communicate with various communities on messaging on breast cancer prevention and the type of coverage that's available and resources that may be out there for them. And we have also, and I think we've shared a copy of the deck with you all. There are some appendix slides that I'll just skip to. I'm sure you may have this information already, but we just pulled it in case you were interested on, the federal program that's available that provides breast cancer screening and early detection for people who may not have coverage. And also, we noted that there is an advisory committee on breast cancer in young women, which I believe is one of the charges for this committee. So just that's all out there in the appendix, and other community programs that support these efforts.
Thank you. Thank you so much. We'll definitely take a look at that. Anyone else, questions or comments? Please feel free to raise your up. Okay, Linda.
Hi, everyone. I have a couple of questions about coverage. So one of your slides said that there were charges, co-pays, deductibles for mammography, reconstruction, and mastectomy. And I'm wondering, first of all, under the Husky plan, if there are any charges associated with any of those that I mentioned, the reconstruction, mammography.
I can speak to the qualified health plans offered through Access Health. You would have to speak to the department, but my understanding is under, certainly under Medicaid, that there is not cost sharing for those programs. And just to point out, the mammography that fits within the mandate that was on that slide is considered preventative and does not have any cost sharing.
Okay, I guess I was a little more surprised about mastectomy and reconstruction. So what happens if a woman has one of your plans and she requires mastectomy and reconstruction and can't cover the co-pays or the deductibles or the cost sharing?
I mean, that's, like any service that you might need under your health plan. I mean, the plan will pay its amount. I don't know, if hospitals or other places might have other programs in the instance where a consumer, is challenged to meet their cost sharing for the service, just like any other surgery or treatment.
Okay, so I was just wondering if your programs had any other funds available or access or an ability to switch over to Husky if that was needed at that particular time.
There isn't any other program, but if the person was eligible for Husky, as Katie mentioned, you can enroll in Husky at any point during the year. So if someone had an income change or a household size change that made them eligible for a Husky program, they can certainly come in and make that update and they would go into the Husky program. And there may be other Husky programs, providing specific breast cancer things. The programs that come through our system are what are called the MAGI programs, the Modified Adjusted Gross Income programs. So Husky A, D, and B, CHIP. But some of those other specific programs and Husky C, that would all be, they're all administered obviously by the Department of Social Services, but those eligibility for those other programs would go through the department specifically, not through our joint system.
Okay.
So we're not the administrator, the eligibility comes through our system, through our joint system, but then all the management of those programs goes through the Department of Social Services.
Oh, okay. Thank you.
Sure.
Great. Thank you, Linda. Anyone else? Questions for our presenters?
I had a question.
Sure.
It was a great presentation. Thank you very much. So I had a question about, I definitely appreciate that the coverage for Access CT Health definitely includes preventative care, which would include a screening mammogram and, if appropriate, screening MRI, screening ultrasound. I didn't hear any mention about what if that patient has a lump and they have to go for diagnostic imaging and they might need a biopsy. It sounds like those services are not necessarily covered, or there might be copays.
There may be copays, yes. So in that instance, it would move from preventative screening and it would move into the other coverages under the plan. So the cost sharing would depend on the plan. And then obviously also would depend on whether you were seeing an in-network provider or an the cost sharing amount would depend on whether it was an in-network provider or an out-of-network provider. So all those questions, could be answered by the specific insurance carrier.
Do you have any idea of like the actual coverage, like the average range of coverage? Because in my experience, this is a major issue for patients. So I'm just curious if you know.
Yeah, I don't have any specific information. I can see,
Okay.
The carriers would probably be the best source for any of that claims, information. We don't have any of their claims information. We handle the enrollment and the financial assistance. But then just like DSS is managing the Husky programs, the insurance companies are obviously managing all of the, claims processing with their members.
Okay, thank you.
Thanks, Dr. James. Vicky.
Hello, I'm trying to get myself on my computer, but it's nice to be with everybody. And thanks, Susan, for the presentation. I just wanted to make sure this group, I don't know if this group had a presentation previously, so just stop me if you did on, the limitations of Connecticut law versus federal law and how we operate in Connecticut. And that is to say, Access Health has insurance products that are people are enrolling in off of the Access Health platform. And those follow state law, right? But the significant majority of people who are enrolled in health insurance coverage in Connecticut or health coverage in Connecticut are in plans that are regulated by the federal government, over which we do not exercise authority. So that's important for you all to know, I think, because lots of times what happens is we pass laws in Connecticut and they apply to a subset of people who have insurance products that we actually can regulate. And it's just a limitation that we can't control. There are federal laws on coverage that, Susan highlighted some of this information on this slide. There are some federal laws on breast cancer coverage or breast health coverage that we could probably share with you, but just wanted to make sure people understood the limitations of, coverages and the laws in Connecticut and how far they reach. I don't know if that's helpful or not, but I think it's important that people know that.
Vicky, do the participating carriers in Access Health Connecticut, are they adhering to the federal regulation, or are our state laws applicable?
So we have, so in general, how this kind of stuff works and this is a very generalized statement, and Susan can chime in if she thinks that I'm not correctly characterizing it. But generally speaking, there are federal baseline rules usually that apply across the board, and the feds are involved in insurance regulation, but they often defer a lot of that to the states. So with respect to insurance products, which is what Access Health is selling, is our insurance products, and then we have a certain number of people who are in insurance products that are not on the Access Health, by the way, that are sold in Connecticut. We can pass laws above and beyond that, generally speaking, that offer additional protections, as long as they don't conflict or make those federal laws inoperable, generally speaking. Then there are federal laws that apply across the board from the United States Department of Labor, generally, to these large employer plans. So if you're employed at, let's say, General Dynamics, United Technologies, Stanley Black & Decker, for instance, the state of Connecticut is a self-funded plan too. The state employees are in a self-funded plan, slightly different regulation, but not the principle is the same. The federal law really controls there. So our large carriers operate as insurers for the plans that are sold on our insurance exchange and to, generally speaking, small employer groups in the state of Connecticut. But those carriers generally operate as what's called third-party administrators for these large employer plans. The way to think about it is these big employers are the actual insurers themselves for their large plans. And then they contract with, let's say, Anthem, Cigna, Aetna, United Healthcare to administer the plan for that employer. But the employer is actually the insurer in those large employer plans. And as of today, about 70% of the people who are privately covered or covered by private insurance, that is to say, not Medicaid, not Medicare, is about 70% of the Connecticut population. So most people are in plans that are not regulated by the state of Connecticut. That's the other way to say that.
And thank you, Vicki. The federal regulation, Vicki's saying with the U.S. Department of Labor, is what people refer to as ERISA plans. So to Vicki's point, the majority of people covered by what everyone thinks of as private health insurance in Connecticut are actually covered by these self-funded ERISA plans. So they're not subject to a lot of the state insurance regulations, such as these mandates or other things versus the plans offered through Access Health, and some that are offered off exchange that are fully insured plans that are subject to all of those regulations, in addition to the ACA.
Right, so it might be good for you to hear, maybe we can come back on another point about what some of the federal laws are on this subject. And we could do that at a subsequent meeting if you're interested.
Yeah, I just
Yeah.
wanted to chime in here because Representative Gilchrist helped us get a law passed in 2019 that covered the cost of ultrasound for women with dense breast tissue. And we're currently trying to get the federal regulation approved at the FDA, and it is not moving, and it's not moving. And so that state law that is so incredibly helpful to people with private insurance really has absolutely no impact on the vast majority of people in the state, of women in the state. And so, it's critically important to know these differences and understand them, and to try to help as best we can for the people who aren't covered. And I just wanted to clarify that particular issue.
Yeah, thank you, Vicki. I'll follow up with your office. I think that'd be a great presentation.
Okay, sure.
Any other questions or comments? Well, thank you so much to our presenters. This was really helpful information. We'll get this deck out to folks. I really appreciate you taking the time to be with us today.
Thank you. Thank you all.
Thank you.
Next,
Thank you.
Next, we're going to hear from Rosa Rodriguez. She is the Breast Health Navigator with Planned Parenthood of Southern New England.
Hi, let me get this. Hi, I'm Rosa. I'm the Breast Health Navigator. I actually cover the entire state of Connecticut and Rhode Island for all of our 13 locations, our clinics. And we do have a little PowerPoint with the services that we cover and then how we get our resources and retain our patients. Let me just put that up. Okay. Are you able to see that?
Yeah.
So this is, okay. Let me just move this over, and I apologize. Okay. So with Planned Parenthood of Southern New England, the mission of a Planned Parenthood of Southern New England is to protect the fundamental right of all individuals to manage their own sexual and reproductive health, and to ensure access to services, education, information to realize that right. Okay, these are a list of several of the services that we provide. As you see, breast and cervical cancer screenings is on the top right. We have annual exam, pregnancy tests and counseling, gender affirming hormone therapy, surgical medical abortion services. These are a list of several of our services that we provide. You can read through them if you like. If you have any questions, certainly do ask. So, these are our patients and our services. Now you see, we do provide abortion services, but it's at 6%. The cancer screening and preventative services are 7%, which is a little slightly higher. But these are the breakdown on services. Reproductive services at 26%. Comprehensive primary care. We just started primary care services the last couple of years. So we have primary care providers in our Hartford location and also in our Stamford location. And these are the breakdown by age. We do focus on, let's see, we do, like I said, we do provide, a range of services. We serve over more than 62 young people and adults each year in Connecticut and Rhode Island. But we do service plus 40 at 11% as well, as you see here in this graph. And based on our annual data shown here, the majority of our patient visits are STI screenings and contraceptive care services. Although we do proudly provide safe abortion services, it is not the majority of the visits that we see. We also provide care to the main 3 age category groups, which is 20 to 24, 25 to 29, and 30 to 39. But definitely we have 11% of the 40 plus population as well. Okay, striving for health and equity. We view healthcare as a human right, and we will see that in this country, you will see that in this country, there are still immense barriers to healthcare, ultimately impacting one's ability to live a healthy life. That is why we work on to view healthcare through a justice lens, striving for the goal of health equity. In order to work around some of these barriers to healthcare, we offer transportation, lift transportation, provided to patients with any type of high risk or any type of breast issues. And of course, for any other certain services that are high risk. We now also provide telehealth for the last couple of years since COVID, right before COVID, which we have an increase of patients utilizing the telehealth. Once again, we provide primary care services in Stamford and in Hartford, which is in the Albany Avenue location. So we have clinicians there able to take patients without a long wait. We can get a patient in for a full physical within a 4 to 5 day period, instead of waiting, 30 to 90 days for a physical. With other community clinics, we are able to get them in immediately. If not in if not in Hartford or Stamford, we can also provide preventative care and some primary care services at our other locations. We also provide funding services. We enroll our patients that are uninsured or undocumented in the CEDDP program, which is the early detection program, which I love. Thank God for them, thank goodness for them. And we also provide the pay what you can or sliding scale. But we also have an enrollment specialist for the Access Health that also can enroll them into Husky. I am able to assist enrolling our patients, my high-risk patients with breast issues in Access Health as well. So we have 2 individuals that are able to provide those services. Okay. The community and navigation collaboration. Patients come through us through multiple channels, including hospitals, which is through the early detection program. ERs, emergency rooms, are one of our biggest referral resources as well. The mobile clinics. Anytime they have a fair, we have a mobile clinic with the program. We are sure to be there in attendance because most of the consumers or patients that are going to be there are uninsured or underinsured. We also get our patients through, or new patients through churches. We were participating until COVID at Grace Church in Old Saybrook every 3rd Thursday of the month. They have a resource. It's like a resource, food share, Access Health, well, enrollments. The dentist, the pharmacy, and one of our clinics are there to provide services. Over 125 people participate. They hold it there because the town of Clinton, Old Saybrook, Kenilworth, their closest in-person resource or DSS is in Middletown. So they have this fair every month. Yes. So this is a great place to find patients, not only from Old Saybrook, but there is a need in that area for services. Of course, Access Health, always referring our patients over to Access Health for enrollment on the Husky program. And we also get referrals from our specialty and outside providers like our surgeons or imaging department that get patients that have no insurance. They refer them back to us to see if there's anything that we can do, any type of programs that we can enroll them in. High schools and colleges. This is one of the bigger resources as well. We have a program called the STARS program at all of our locations, major locations, which participate with all the public high schools. They encourage the youth program to participate in reproductive services, on healthcare services. So they go out to the school and they do it's our education department that goes out and provide these services. And we also do, in the clinic, they do some focus groups with these young teens in the STARS programs. I think it's in Bridgeport, Hartford, Stanford, and in London at those clinics. But we also participated with Capital Community College right before enrollment, school enrollment. A lot of the kids don't have insurance, looking for insurance or looking for services, don't know where to go. We collaborated with Capital Community College, and that was wonderful because our new patient increase was great for those 3 months. Let's see what we have. So the breast navigation services that we provide are breast imaging to anyone with no insurance or income that have insurance but their deductibles are high. They can also, possibly qualify for the early detection program that will pick up some of the services if they have a high deductible. We refer them off to for breast evaluations, genetic testings and counseling, not only for breast, for any type of genetic testing, and also provide transportation for any of these services. Okay, this in 2016, we were given a grant from Coleman, and this is when I came in. Prior to that, I did 2 years of Access Health, certified through Access Health. But in 2016, we took on a grant with Coleman. I think it was in August. So just doing the navigation on breast issues and any type of breast concerns. The first year, we had 169 new patients that came in through our door. On the second year, in 2017, it was 627. And this is just breast issues. In 19, it went up to 866. Through COVID, it dropped down to 617. And as of yesterday, it was 827. So there is an increase, there is a need. Prior to 16, I did all the navigation for primary care, doing the enrollments for Husky or Access Health, plus doing the breast navigation. In 16, they realized that the need was really high in breast navigation. So they hired a primary care navigator to focus on primary care. And then they focused on an enrollment specialist. The barriers to care are not having insurance or underinsured, which is the undocumented, or individuals that have private insurance where the deductibles are really high. They don't know or aren't aware. They still could qualify for funding through the programs and through other resources that we have. And that's one of the bigger issues, transportation, but we will provide, of course, lift transportation. Lack of community services, and I say that Fairfield County, this is one of the biggest issues for us, and also on the shore, which is Killingworth, Osage, Clinton. There were lack of resources. Like I said, in that area, the nearest in-person was Middletown. So we would come in once a month to provide services to that local community. And then the biggest one is the fear of initiating care. Once they get imaging and have to go in for a biopsy or to see a breast get a breast evaluation, a lot of the patients fear knowing that there's something wrong with them due to having to not being able to work or provide for their families because they think they automatically have cancer or they're going to have cancer. So fear of initiating care is because a lot of the individuals that are having these issues are afraid that they're going to get a diagnosis as a positive diagnosis. So we encourage them, we follow up with them, and I'm sorry about that. And we work as a care team to make sure and make them feel comfortable that, the cares or the services are there whenever they're ready and comfortable. we can get them into any of the locations. Okay. Funding resources. Most of the patients that come in through our door are either uninsured, underinsured, undocumented. We make sure that all these patients are offered something so that they're not paying out of pocket for their costs as much as possible. We offer in every one of our clinics family planning services, which covers general services, like STDs or birth control and other services to that. If they don't have insurance and we see that they qualify for Access Health, we get the specialist to try to get them enrolled, or we give them numbers so they can access either Husky or QHP. For undocumented, we have the program, which is the early detection program, which is amazing. We enroll them into that because they can have their CEBs, which is a clinical breast exams covered, the full exams covered for that day. They have ultrasounds, they have the biopsies, the mammograms, routine mammograms, breast evaluations that they will cover for uninsured, undocumented, and underinsured patients that qualify. And then the last resource that I have, which is amazing as well for funding, is the American Breast Cancer Foundation. This organization is amazing. It's patient driven, but they will cover anyone at any location. They are not specific to any hospital, any radiology. They contact the patient. The great thing about them is when I utilize them is that the early detection program, one of the services that they can't cover or are not able to cover are MRIs. That's when I go to the American Breast Cancer Foundation, which covers plenty of services, ultrasounds, biopsies, MRIs, breast evaluations, emergency services. They provide so many different resources for our patients. So I make sure whether they're insured, underinsured, undocumented, it has to do with breast, they will get service, and as much as I can for them not to pay out of pocket. This is the care team. I think a lot of the retention and with the new patient that we've had is when we created the care team, which of course I started back in 2014 as the primary care navigator, the breast health navigator, and the insurance enrollment specialist until 2016, when they realized there was a high demand for breast navigation and there was high risk. Our numbers were really high. I focused on breast health navigation, and they hired Bianca Santiago, which in all three of us are bilingual. And she does all primary care navigation services. Jasmine Osario, she's actually certified through Access Health. She just got her results just back, and she does all the enrollments. I try to keep all the patients that under myself that need to be enrolled, and I assist them through Access Health, just because there are a lot of patients that need insurance, just to keep it, focus on breast issues on one side, and then Jasmine does all primary care or anyone else that comes through the door. And then Jessica Johnson, they created her position. She's a senior program manager of care navigation and expert, which is a new program that it's a program that we've had, but she focuses on the expert program. So we all have all those services, all the coordinators and navigators that are able to assist and retain our patients and do extra follow-up to get them care. And I went through it a little quickly because I know we're short in time. But if anyone has any questions, please let me know. And I will definitely, I didn't provide the contact information for Christine for the National Breast Association, but I can provide that if anyone ever needs to contact her. She is amazing. She speaks several languages, Spanish, French, and I think Polish. So she's amazing. You would end up giving her a call, leaving a message, and she does callbacks on the same day for any of the services.
Thank you so much. This was really, really interesting. It is so telling that once there was the focus on, having a specific breast health navigator, that the numbers increased so significantly.
Yes.
So I do have one question. When it comes to the STARS program, which I am familiar with, I'm so happy you brought that up. Do you know, do they teach in the STARS program about breast health to the youth?
They don't. What they do is they have me come in to do to teach them how to do clinical practice. I'm sorry, self-breast exams, so they can do their own, do the self-breast exam. But I haven't done one in a long since COVID, to be honest with you. But they do the education. The education department does come in and educate them on all the services that we provide.
Okay.
And how important it is for them to start checking, in the shower or whenever they feel comfortable, or if they feel a lump under their armpit, to please, it's not just nothing just because they're under the age of 22 or 23, because the numbers are increasing for 26 and under right now for us in our clinics with breast issues or high risk.
Okay. Thank you. Thank you so much. Linda.
Thank you so much for your presentation. It was really fascinating. I know very little about Planned Parenthood, and I really appreciate what you said today. My question has to do with the parameters that you use for mammography and for breast screening. Do you use state guidelines, or does a caregiver have the option to just provide a mammography if that's his or her decision? What parameters do you use in terms of age in order to give that care?
There is an age category for, that would need mammograms or ultrasounds, but under the age of, I say 38, if there is any type of breast issue, whether it be, let's say, nipple discharge, let's say a lump or a mass or itching, there are services that the clinician will be able to provide for under that age, not just routine screenings, people that just need routine screenings. So if they find something and they suggest it, they will suggest it to the patient, encourage it to make sure they get checked and give them the option.
Okay, and is family history something that's?
Yes, they obtain family history. As soon as they come in and a patient is doing the intake, they take in a family history of, if they had any breast cancer, if they had any genetic testing, if testing came back positive, we try to get as much as family history and demographics from them.
Thank you so much.
Wonderful. Anyone else, questions or comments on this fantastic presentation? All right. Well, thank you so much, Rosa, for being here and for the work that you do. You've given us a lot to think about as we move forward. I appreciate you taking the time.
Thank you.
All right, so now to my working group members. Our next meeting is January 5th at 2 p.m. because of the holidays. We have, I think it's 4 weeks. I have taken the note that it'd be good to have Vicki come back and present about the differences between state and federal. Also, would folks want me to get in touch with Connecticut Benefits Inc., Connecticut, Anthem Blue Cross Blue Shield, and Husky Health CT to see what specifically those providers cover in terms of the issue between the prevention and then if someone does need further care? Would that be helpful to have them come in? What do you all think?
You might be a good pairing. That might be a good pairing with the discussion about self-funded plans, because then you'd have the breadth of coverage options, I think, in front of you, of how things are covered across the state.
Okay.
Just one person's thought.
I think it'd be worth discussing. There does seem to be, some pretty significant disparities that I've seen. Hartford Healthcare, for example, as an employer, does cover all of those services. But I think if you work for a different company in Connecticut, they can choose not to. You can be in the same field, essentially have the same job, but not have the same coverage. It's just the way that the system works. It's a little strange. So,
Okay.
yeah.
Representative, this is Dave Boomer. You can see Linda Kowalski's name here. I'm obviously not Linda. One thing we wanted to suggest is there had been legislation last year on breast cancer screening. It was House Bill 6626. I believe it went it went through the Insurance and Real Estate Committee, went through the House, but it was not taken up in the Senate. And that has a lot of provisions in there that might be relevant to our discussion. I'm not endorsing it, but I know Vicky's familiar with it and so forth. I think one of the problems in the Senate is there might have been a cost to it in some areas because I believe, if I recall, any women who are high-risk women who would have, cancer would appear, there'd be no cost to her on any diagnostic testing. And so, that could, prior law talked about screening tests, and this would have added in diagnostic. And I'm not saying one way or the other, express an opinion on it. I think the cost may have been an issue in the Senate, but it might be worth getting that bill to everyone, and we could look at that, and maybe there's some ideas from that could fit with possible recommendations by your group.
And so Representative Gilchrist, I think we should also explain, when we talk in January, one of the reasons that bill may have stalled is they're under the Affordable Care Act. State mandates that have passed since, we can't pass a state mandate in Connecticut beyond the existing mandate package that was in place in 2011 without incurring state expenditures. That's just a federal limitation on the expansion of mandates. This is why, if you follow the Insurance Committee action, you can see, a lot of mandates have been introduced, but they've not made it for that reason, because the state has to pick up the cost, because
Okay.
the federal government will not pay its portion of tax credits and things that come to us for those benefit packages, unfortunately. It's a real limitation, but it is a law.
What was that bill number?
6626.
Great, thank you. Okay, that would be wonderful to be on the agenda as well.
Linda looks very different right now.
All right, anything else for our next meeting? That seems like that'd be a full conversation. All right, wonderful. Well then, thank you all for being here. Sorry again about the little bit of confusion at the start, but we all made it on. Happy holidays, and I'll see you on the 5th.
Great.
Have a great holiday, everyone.
Bye now.
Thank you. Happy holidays.
Happy holidays.